On today's show, we'll explore the phenomenon of type 2 inflammation in the skin and what we can learn from it in the respiratory tract. We'll look at what type 2 inflammation is, its role in causing disease, the advent of biologicals in treating disease, and the outlook for those suffering from chronic skin and respiratory inflammatory conditions. This is EUFOREA News, broadcasting around the world from London. Hello and welcome to EUFOREA News. My name is Dr. David Bull and welcome to our second show of November 2021. Now, over the last few years, there has been a huge amount of research into the role of the immune system in the causation of various types of skin and respiratory disease. Of particular interest is the role that type 2 inflammation plays in the etiology of a wide range of conditions such as atopic dermatitis, chronic rhinosinusitis, asthma, and chronic urticaria. As researchers understand more about the complex pathways of causation, novel therapies have been developed which have completely changed the outlook for patients suffering from these conditions. In a minute, I'll be talking about the mechanisms of disease causation and the novel therapies that have been developed to Professor Peter Schmid-Grendelmeier. He is head of the Allergy Unit, Department of Dermatology at the University Hospital of Zurich in Switzerland. The type 2 inflammatory response is crucial in fighting certain types of inflammatory conditions. But researchers have known for a long time that sometimes this inflammatory response, where T helper cells are stimulated to produce and release the typical type 2 cytokines IL-4, IL-5 and IL-13, give rise to chronic inflammation and can lead to chronic disease such as atopic dermatitis. But this knowledge has led to new therapies known as monoclonal antibodies or biologics that target specific parts of the inflammatory cascade, and these have radically changed patient outcomes. Well, to tell us more about this, I'm delighted to be joined by Professor Peter Schmid-Grendelmeier. He's head of the Allergy Unit, Department of Dermatology at the University Hospital of Zurich in Switzerland. Peter, thank you so much for joining me. I've outlined the basis of the type 2 inflammatory response, and the knowledge of this has led to the development of biologicals. Perhaps I can start by asking you, what has been the impact of the development of these biologicals?
For atopic dermatitis, it has a big impact because for years, even decades, we did not have a really appropriate therapy for severe forms. Of course, we had some immunosuppressive agents like cyclosporin A or systemic steroids, but our patients with very severe or moderate forms even of atopic dermatitis, we could not really offer a good therapy. And since now biologics, monoclonal antibodies have moved in also for the treatment of atopic dermatitis, this has really changed the area. We can offer an adequate, very efficient, and as it looks also safe therapy to many of our patients with atopic dermatitis nowadays. So it's really a game changer to have these products like dupilumab that addresses some cytokines like IL-4 and IL-13 directly. It's injected, but it's a big help for our patients.
And what do the patients say about these biologicals? I assume, as you say, it's a game changer. They must be delighted.
It's really like that many of these patients are so thankful. Some of them are, in the beginning, of course, skeptical because they have tried so many things. But when they see that after 2-3 months, there's really a dramatic change, they are really so thankful. These are the patients that is very nice to accompany, to offer them something because we can really change their life that was maybe for years really heavily impacted by the disease of atopic dermatitis with itch, chronic inflammation, dry skin, and now suddenly it changed. And what is the nice thing is there are actually very few side effects we have to be afraid of, so they tolerate it well. It's injections that they have to do, but in the beginning we do the injections, then those patients who want, we instruct them, but they easily accept this, and most of these patients are just very, very happy with these new treatments.
So is it fair to say that the advent of the biologicals has changed your approach from a personal side? Has it changed your approach in dermatology?
This is absolutely true for atopic dermatitis. That really changed our approach for these severe forms, even sometimes moderate forms, as we can offer now a specific treatment. There are more monoclonal antibodies and also molecules coming, but we can really now offer a very good treatment, which in addition also sometimes helps to reduce comorbidities. So I'm really looking forward now to see patients with severe AD. Some of them, of course, we follow up since years, but some of them are referred now, and it's really worthwhile to refer them if they have been frustrated with therapies that didn't work for their severe eczema. And therefore, it's really, it has changed our approach, absolutely.
Well, you mentioned dupilumab there as one of the biologicals, and clearly there are more and more coming online the whole time. I'm interested to know whether this now means that there would be more collaboration between, say, dermatologists and respiratory care physicians.
That's a very important point. I think using a biological, like, for example, dupilumab, that helps in many of these type 2 associated disease, so asthma or other diseases, really has broadened our collaboration with lung specialists, ENT and other doctors. So the interdisciplinary exchange is much closer because we see these drugs work also for other diseases. So we have to collaborate with our colleagues. They address patients to us with AD. So there's a big mutual exchange, collaboration, and we understand better other diseases. We learn about other diseases. And as we are using the same drugs, there's a much closer collaboration. This is the collaboration in daily clinical patient work. So we have common boards for some of these patients, but it's also collaboration in research, whether it's translational or also experimental research. And also in education, we have now common work groups or master classes addressing both lung specialists, skin specialists on the approach on these T2 type diseases. So it has broadly enlarged the collaboration between different specialties, which I highly appreciate, and which also reflects the burden for our patients, which very often have several organs, several parts of the body affected.
How difficult was it to get that collaboration between the different specialties? Because certainly in the past, physicians were quite parochial about their own specialty. Was it difficult to get the collaboration to come together?
I must say in the setting I work at the University Hospital of Zurich, or also with Swiss colleagues from lung, skin, or even on a European base, I wouldn't say that it's difficult. It's we often are embraced, we are invited, we invite our colleagues. And nowadays, I think there's really more this thinking which is patient-orientated than, oh, this belongs to my specialty or this belongs to the other specialty. It's more based on the patient on one side and on the pathophysiological aspect. So I think it's really going very well, and it's very also fertilizing medicine, and I hope it also improves patient care.
I'm assuming this shared knowledge actually helps to benefit all the specialties. So I'm assuming it will help in prediction of, say, therapeutic response and about steroid sparing. I assume the sum of all of this knowledge is very helpful to patients and to physicians.
Absolutely. We can reduce steroids, we can reduce other drugs, we have less side effects, and we really embrace, as you say, many specialists. It's respiratory specialists with skin, gastroenterology specialists, rheumatology. It's really crossing the borders, and I think it will bring us a big step forwards to a patient-tailored medicine and treatment.
And if I was to ask you finally to gaze into your crystal ball, what do you think the future looks like in terms of biologicals being used in skincare? Do you think the future is bright?
Oh, the future is very bright. There's still, of course, a lot of work to find out which patients will benefit the best from which biological, at what stage, or are other molecules important. But I think it's extremely exciting now. And for our patient, it's really very promising what expects us. So I think it's really very bright, our future, to treat skin diseases also with biologics.
Well, it's been a great pleasure to talk to you. Thank you very much indeed, Professor Schmid-Grendelmeier.
The pleasure was mine. Thank you.
Well, that's it for this second EUFOREA News Show of November. Many thanks to my guest, to Professor Peter Schmid-Grendelmeier. Now, as always, you can find more information about EUFOREA and register for the EUFOREA meetings on the euphorea.eu website, where you can also sign up to receive the latest news via email. Our Twitter address is @EUFOREA. Make sure you follow us and keep up to date. Until next month, though, goodbye.